Well, thanks to increased screening and awareness, more women are surviving breast cancer than ever before. We are joined now by Dr. John Hijjawi with Intermountain Medical Center for more on the options for women after a mastectomy. Thank you so much for joining us.
Great to be here, Surae.
So there are options that we're hearing more and more, and they are pretty exciting for women who have gone through this horrific stage in their life.
That's right. As you said, with more screening, we know that 1 in 8 American women will get breast cancer at some time in their life. And sometimes the entire breast has to be removed to treat that cancer. Now, folks are familiar with breast implants. They're used sometimes just because someone wants fuller breasts, but in the cancer area, breast implants can be used to reconstruct the breast. More unusual is to use living tissue from another part of the body, usually the tummy, and transfer it up to the chest to reform the breast, kind of taking like and replacing like, because they're similar tissues.
A place where you don't like, this is a win benefit for someone who might have some weight around the midsection, and they can use that for breast reconstruction.
Right. Cancer's terrible, but it's the silver lining.
That's a silver lining. Now, is it becoming more popular? Are you seeing more patients come to this option and this conclusion?
Yeah. You know, even in the United States, believe it or not, only about 25% of American women will get breast reconstruction after a mastectomy. But using living tissue is becoming more and more popular as we have better techniques to transfer the tissue. Years ago, we would have to take the muscle of the abdomen to do this operation. Now, we don't take the muscle. We just take the vessels and the fat and the skin, so that all those activities can keep happening years and months down the road.
And I imagine recovery, that helps as well for recovery time.
Yeah, less pain medicine, less time in the hospital, and a quicker return to activity. And then long-term, not changing your lifestyle. We don't want these operations to mean, oh, now I can't go skiing or biking or goof around with my kids.
Well, and I'm sure another deterrent, I guess, would be cost. So are more and more insurance companies recognizing this to be covered in their insurance?
Sure. So when the mastectomy has to be done because of cancer or because a patient has a genetic predisposition to cancer, we've all heard of the BRCA gene. Insurance companies are actually required to cover those operations, not only on the breast that has cancer, but also on the other breast to make it more symmetrical if that's necessary.
And so maybe patients really don't know that there's this option available.
That's right. Not only do they not know that mastectomy reconstruction is available, but even if they've had a lumpectomy where just part of the breast has to be removed, we can do things to improve symmetry that might result from that treatment as well, and that's also required to be covered by federal law.
Very interesting. Well, what other options would you like to tell patients?
Well, a really exciting new thing that's been going on for about the last 5 or 6 years, more and more, is to not necessarily have to make a big incision to transfer tissue, but to just suction some fat out, like you might see in a liposuction television show, and inject it into the breast in very small amounts and rebuild the breast even without a really big scar, and that's very exciting.
That is exciting to think that the technology for cosmetic surgery can be used in other areas of real importance, obviously, for people who are maybe facing a life-death situation.
Absolutely, and I really don't like to think of separating cosmetic surgery from plastic surgery. I think that any quality plastic surgeon is trained in both cosmetic and reconstructive techniques, and so they bring those all to the table, and those are the kind of surgeons that really, as board-certified plastic surgeons, can do a great job.
Well, thank you so much, Dr. John Hijjawi from Intermountain Medical Center. Thank you so much for your time.
Great to be here, Surae.